I also really did like in preparing for the podcast and reading your articles and in your book is the correlation of anxiety and hope. And I think we can maybe talk to that a little bit. How does anxiety trigger hope, or how can we frame anxiety to actually create hope for ourselves, but also for society and for bigger shifts in society?
The first step to understanding how to find the hope in anxiety is to really
Mm-hmm.
start by just listening to it, to take it not as a
Mm-hmm.
danger signal to avoid or suppress, which always makes it worse, but to take it as information about what we want in the future, what we care about. And so when you are open to that possibility, all of a sudden you see that future, which can be scary because it's uncertain, it's also full of possibilities. It hasn't shut down for you because you're only anxious when you're in it to win it. You think that a positive outcome is still possible, because otherwise you would be despairing about the future.
Hmm.
Anxiety tells us that we still have reason to hope. And so when we listen
Hmm.
to it and we see that, oh, that bad thing hasn't happened yet, I'm waiting to get those medical tests back, right? Or I'm waiting to, and I tell a story in the book about how my son was born with a congenital heart condition that I knew would require open heart surgery when he was 4 months old, or an infant. And, I was extremely anxious about that, obviously, but
Obviously.
I wasn't despairing because I knew that he could die. But I also knew if we worked to get him the right treatment, he could survive and
You could
thrive.
thrive.
So that is
Hmm.
where anxiety sets us in our life. It sets us to move into the world of possibilities and creativity, innovation, thinking outside the box to get that thing you want and avert disaster.
And I'm just thinking out loud, is there particular mindset shifts or tools or techniques that also less experienced people with anxiety could follow in order to first understand that anxiety levels are rising, and then also to use it for their own motivation, for their own decision-making processes? I don't know, does anything come to mind?
Yeah, I was realizing I really need to create those resources, but they do exist. A lot of
Hmm.
it has existed in the research literature up till now. And I think people really are, mindset interventions are nudge interventions, which are
Uh-huh.
really, when we think about the future of mental health, and as you were articulating, there's opportunity here, there's possibility. I think it's these nudge brief interventions. By definition, these are things that are brief, but also that are sort of pivotal, that have a very
Hmm.
powerful, exponentially powerful impact, because they're targeting something that's a linchpin in a problem and a solution. So when it comes to mindsets, our mindset about anxiety is a very simple practice in many ways. So, and I'll cite some research to illustrate this, research that's continued and has been replicated and is starting to get out there. So out of Harvard, Jameson and colleagues, I think it was back in 2013, they published a seminal study in which they had people who were socially anxious, who had social anxiety disorder, do a
Hmm.
mindset shift as they were about to embark upon something that was an extremely anxiety provoking situation for them, which was to give a public speech impromptu with very little
Hmm.
preparation.
Hmm.
Someone who's
Preparation.
socially anxious it's like that's kryptonite for them, right? They're terrified of that social judgment. And they were about to give a speech in just a few minutes in front of a panel of judges who already, were like, we're already looking very
Hmm.
judgmental and
Hmm.
negative. But half of those people were given a mindset intervention. And what they were taught was they were said, listen, you're going to feel these anxious thoughts and feelings. It's going to feel bad. Your heart's going to race. Here's what you can anticipate. But here's some biological evidence to show that that's actually not your body preparing to panic and fail. It's actually your body preparing for you to succeed. So your heart is racing because it's
Hmm.
pumping oxygen to your brain. Your fight flight system, it's kind of activating, but mostly because it needs to rise to the occasion. And so you don't need to panic about that. And this is something that humans have evolved to do. And here's some research and evolutionary theory to show you that. So essentially, for about 15 to 30 minutes, people were just taught to shift their mindset slightly, to consider the possibility that anxiety was
Hmm.
an ally, one that you need to negotiate with, like most allies, but an ally in that moment to them. The other half of the folks were not given that information. And what do you know? When they actually went and did the speech and were not only, they were monitored their heart rate and their blood pressure, they were also judged on the quality of their speech. The people who had the mindset shift, they performed better. They had fewer stutters, ums, ahs. They showed more confidence. They also had lower blood pressure and lower heart rate. So this sort of cardiovascular profile that was about really primed to perform rather than primed to panic. Whereas the other half of the folks, they were much more in this panic mode and did more poorly. So that was a 15-minute exercise. This is something that in some form or the other, we can do every day as we anticipate things that we're going into, as we're thrown into the deep end of a situation. We can take a moment, listen to our anxiety, reframe it as a potential ally, and gain skills in working with that ally and taking the best. And, sometimes it's not useful, and we can learn ways to cope with that. And certainly anxiety disorders, I'm not just saying to people suffering from anxiety disorders, oh, just shift your mindset and everything changes. But even with anxiety disorders, a mindset shift will help profoundly if it's practiced over time. And it will help you do all that other really hard, messy work of being human that you have to do when you're struggling with an anxiety disorder.
So if you like that, make sure to check out the full-length episode here and leave a subscribe. Thank you.